there was a time where I had a patient come into the emergency department and I had to insert IVs on him, except he was very dehydrated and had thick skin. So I thought this was going to be a challenge, but I ended up inserting the IV, except for when I was retracting the needle, the catheter wasn't fully inside. And I kind of started to panic because I was like, uh-oh, like I needed to remove this IV and restart this IV. And the patient was scared of getting poked, so I felt really bad. And then luckily my preceptor was standing right next to me and he was like, you know, that you don't have to remove this IV. And I was like, what? And he explained to me that you could use positive or negative pressure to insert the rest of the catheter without retracting the whole catheter. Sorry, I didn't practice this question at all. My preceptor taught me that you could actually attach a flush to the end of the pigtail, and as you are flushing the IV, you could actually also advance the catheter. So this is something that I had no idea you can do, and it really helped just get the catheter right in, and it allowed me to not have to repoke the patient who also did not want to be poked again. And something really cool about this is that a week later, I was standing next to a paramedic student who was also inserting an IV, and the same thing happened to her. And I was able to use what my preceptor taught me, and I showed her how to attach the flush and use the positive pressure to end up inserting the IV also without removing it. So this was a super great learning experience, and it's also something that I was able to share with other people who also needed the additional support.
I would also just say something about how you love when anyone's willing to give you any tips and tricks like that that just
Mhm.
help make your job easier. You always really welcome any feedback that anyone has.
Mhm.
Okay, cool.
And then he
Cool.
also taught me that if that doesn't work, I could also try pulling back and retrieving blood from the catheter as I'm pushing it in, and that also helped,
Oh,
which is
cool.
something new.
I'm gonna try this someday. Can you please tell me about a time when you received constructive feedback from an instructor and how you made changes going forward?
This wasn't working as a student. This was actually when I was a medical assistant. I was in charge of gathering paper for surgeries and organizing it for the doctor to look at to put into the chart. And there was a specific way of doing it. It was alphabetical order and attaching the photos that were with it. So I, unfortunately, um, mixed up two patients that had the same last name with an M. And when I gave it to him, he actually charted that this patient had a skin cancer when the other patient that was supposed to be in that order had a skin cancer. And thankfully, it was caught right away. But he pulled me aside and just let me know, like, make sure to be detailed, make sure to triple check everything. And he was not very nice about it, but I really took that as like a learning experience. And I'm like, okay, well, also, he's taking the time to talk to me. He could have just, fired me, but he actually sat down with me and explained to me what was going on. And I really feel like when someone takes the time to let you know where you can improve or where you can change, it's because they genuinely care and want the best for you. And I really take constructive criticism well because I know that they're going out of their way to teach me something. And I really appreciate that. So, yeah.
Yeah. You could even say something like, I know how hard it is to have to be the person to give constructive feedback. So when someone is willing to do that for me, I try to really like listen and honor what it is they're trying to communicate.
Okay.
Yeah. If you want to download my list of 72 new grad nursing interview questions, that PDF is linked in the description. Don't pay full price for it as a supporter of the channel. If you use the discount code YouTube, it's only $3. I made it all cute and aesthetic for you guys. It's 22 pages. The idea is hopefully interview day won't be the first day that you encounter whatever question they ask you. I've included every interview question I've ever heard of that any new grad has ever been asked. Don't pay full price for it. As someone who supports the channel, you get it for only $3. Just use the discount code YouTube.
when I would initially give a report during my OB rotation, I would just say everything about the patient completely. Like during assessment, I would tell you all the vitals. The vitals are normal, and I would tell you all the vitals, and I would tell you every little thing and how they felt, and on and on and on. And my professor was like, that is not an efficient way to give report. It's not going to help anybody. You need to just say the relevant things and, say the abnormal things, and not just, if you just go on and on and on, it's not going to, it doesn't matter if the heart rate's like 100, great, like that's what it's supposed to be. So she had me practice it again with just the, what is abnormal, like actual assessment findings. And that made a huge difference because from then on, I give report every shift, every clinical. So I was just able to really use that format and use that feedback to improve something that I'm going to be doing for my whole career. And I was just really thankful for that feedback. And it just made me a better nurse.
Okay, cool. Yeah, I like that. Okay. Like claims. Okay. Cool.
A time I received constructive feedback is when I was working with my nursing preceptor and we were on our way to deliver medications for one of our patients. And mind you, this was a very fast-paced unit. And so we had a lot to get done. And we were walking there and I saw another patient or another nurse's patient trying to get out of bed. And immediately I was concerned because they were a fall risk. So I went over there and I insisted on them. They were trying to get out of the bed because they need to go to the bathroom. So I assisted them to the bathroom and then I waited for them and then I helped them back to bed. And when I went outside, my nurse told me that she was really happy that I had helped the other nurse's patient out. However, that it wasn't really good use of my time and that I needed to find a better balance between my prioritization and delegation and teamwork skills. And when I thought about what she said, I realized that she was right and that I definitely could have approached that situation better. And so I thanked her for her constructive criticism, as I really just needed it as an opportunity to learn and grow, and that I was going to use it to push myself forward. And so I then took that situation and learned from it. And moving forward, when I continue to be always open to helping other nurses' patients out. However, if I had other tasks that needed to get done and were a priority and I was able to delegate, then I would delegate those tasks when needed, just so I could keep my patients safe and get everything done when it needed to be done.
When I worked at the nursing facility, I'd always, sanitize my hands or wash my hands between patients. But because of a lot of the patients I had, I would always put gloves on when I'd enter the room because I didn't know what I was walking into. So at clinicals, at the hospital, that was a habit I had, and my instructor didn't like that I did that because when I would do patient care or check like maybe blood pressure, I'd have gloves on. And she said that from her experience, it's very impersonal to some of the patients. And it's kind of like you're not really seeing them as a person because it's almost may come off as you're scared to touch like skin to skin contact if it's safe to do so. So she was recommending that I not do that unless I was going to be in contact with like body fluids or medication. So her recommendation was not to do that. So you're more personable to the patient. And that took a lot of deconditioning on my end because I was so used to always putting gloves on, like as soon as I walked into a patient room. But it did realize that you come off more, I can't think of, like passionate, I guess, and more not so sterile, like seeing the patient. You see them as a person, not just like your job or just another like task to get done. I can't really word that properly.
I mean, it's kind of just little like what you said, like they're just they're just a human being. Like they're not like a dirty specimen or something.
Yeah.
There, tell us about a time where you received negative feedback or constructive criticism from an instructor.
So this wasn't from a nursing instructor, but I did receive feedback from one of my managers when I had first started as a PCT. She told me, that I was a great, team player, and that, she was really happy that I was on the team. But she said I'm undertaking a lot of things. She was a tech before she was a nurse, so she kind of knew what that was like. So to make sure that I wasn't overworking myself, and that I wasn't taking on too much to the point where it was wearing. So I really took her advice and kind of kept that in the back of my mind. So I took that and I applied it by learning how to ask for help, learning how to prioritize better. And I know that whatever role I'm in after nursing school, I'm going to make sure that I'm reaching out to my charge nurse or my supervisor to make sure that I'm not taking on more than I should.
I was expecting you to say like you've gotten more comfortable with delegating to the patient care techs. When you say like reaching out to your supervisor, I'm like, wait, so is she going to her manager's office and like asking them to clean a bowel movement, or like what is she? I'm very confused. What is she telling me? Like I can't really picture.
Yeah. I guess I was trying to say like that in the future, maybe not my supervisor, but like any nursing colleagues that I have who have more experience, like getting more advice from them and making sure that, like I'm not wearing myself thin, basically is what I was trying to say. Like I basically want to seem like I'm continuously working on this, like I'm always trying to improve on this weakness of mine and get feedback from people.
Yeah, I would say that because I think like what they're going to be expecting you to say is that you delegate, and if you say that you go talk to the people above you, they're going to be like, wait, for what though?